The theme of our topic is common carotid artery and external carotid artery. On this picture you can see the heart. This is heart. Heart consists of 4 chambers. This is right atrium, right ventricle, left atrium and left ventricle. From the left ventricle originates biggest artery of the human body. It is aorta. This one, it is aorta. Aorta has ascending part, aortic arch, and descending part. Descending part subdivides into the thoracic aorta and abdominal aorta. Abdominal aorta. The arteries, veins, lymphatic vessels direct to the organ for the short distance. If from the beginning part of aorta, which call aortic valve, originates 2 arteries, right coronary artery and left coronary arteries, which blood supply the heart. From the aortic arch, from the right side to the left side, originates brachycephalic trunk, left common carotid artery, right subclavian artery. What we can see the position of this the heart inside the thoracic cavity. Here we can see the aortic arch. This is brachycephalic trunk. It is 5 centimeters long and continues into the right common carotid artery and right subclavian artery. The brachycephalic trunk and left common carotid artery lies in front of the trachea. Common carotid artery. This on this picture, right common carotid artery, at the level of the superior border of the thyroid cartilage of the larynx, and it subdivides into the external carotid artery, arteria carotis externa, and internal carotid artery. This place called bifurcation. Carotid bifurcation. External carotid artery blood supply the organs of the neck and outer organs of the head. Internal carotid artery blood supply the brain, membranes of the brain or meninges and eyeballs. External carotid artery gives 9 branches, which subdivides into the 3 groups: anterior group, posterior group, middle group. Anterior group arteries originate from the anterior surface of the internal carotid artery. There are 3 arteries. First, it is superior thyroid artery. Above them, it is lingual artery, and near the angle of the mandible, facial artery. 3 anterior branches: superior thyroid, lingual, and facial artery. Superior thyroid artery blood supply the larynx, thyroid glands, laryngopharynx, and esophagus. and give the branches. Значит, blood supply the hyoid bone and muscles below the hyoid bone. Give the branches. It is glandular branches to the thyroid glands. Superior laryngeal artery, blood supply the larynx. Infrahyoid branch to the hyoid bone and muscles of below the hyoid bone. Lingual artery, blood supply the tongue. Sublingual glands, hyoid bone and muscles above the hyoid bone. What we can see on the anterior surface, it's just larynx, it's just thyroid glands of the larynx, hyoid bone. Here what superior thyroid artery, blood supply the thyroid gland, larynx by superior laryngeal artery. The position of the common carotid artery lies projects to the carotid triangle of the neck. We can palpate the pulse on them. Here we can see the external carotid artery and 3 anterior branches: superior thyroid, lingual, and facial. Lingual artery penetrates the mylohyoid muscle and directs into the root of tongue. In the tongue, on the tongue, the lingual artery give 2 branches. Deep lingual artery, which blood supply the muscles of the tongue and skeletal muscles, proper muscles of the tongue and skeletal muscle. And dorsal artery of the tongue, lies along the middle line of the tongue, on the dorsum of the tongue, between mucosa and aponeurosis of the tongue, and blood supply the mucosa and taste papilles. This artery blood supply the sublingual gland and mucosa of the inferior wall of the oral cavity and muscles above the hyoid bone and hyoid bone. Facial artery originates above the lingual artery, direct to the angle of the mandible, near the submandibular trigon, it gives the glandular branch to the sublingual artery. Ascending pharyngeal branch, palatine branch to the soft palate and palatine tonsils. And on the face, it lies on the outer surface of the body, of the mandibular body, in front of the mesenteric muscle. On the face, this artery gives 3 branches: anterior labial artery, superior labial artery, and angular artery. Inferior labial artery blood supply the muscles of the inferior lip, skin, and mucosa of the oral vestibule. Superior labial artery blood supply the skin, muscles of the and mucosa of the superior lip. Angular artery direct to the middle angle of the oral rima, blood supply the outer nose, give the outer nasal branches, blood supply the skin, muscles, and bones of the infraorbital region. Near the glabella, this artery anastomosis with dorsal nasal artery, arteria dorsalis nasi, from ophthalmic artery. This ophthalmic artery is a branch of the internal carotid artery. This anastomosis is intersystematic anastomosis between the system of the external carotid artery and internal carotid artery. It is very dangerous anastomosis near the root of nose. Posterior branches. Posterior group branches originate from the posterior half part of the external carotid artery. There are three branches: occipital artery, arteria occipitalis; posterior auricular artery, arteria auricularis posterior; and sternocleidomastoid artery. Posterior auricular artery originates in front of the beginning part of the facial artery, lies on the groove for occipital artery on the temporal bone. Blood supply the temporal bone, skin and muscles and skin above of the occipital region. Give the mastoid branches to the mastoid braces, into the mastoid braces, and blood supply the posterior wall of the tympanic cavity. Posterior auricular artery, blood supply the skin and muscles near the posterior auricular region. Blood supply the auricle, external acoustic meatus, and give the stylomastoid artery, which direct through the same name muscle and blood supply inferior wall of the tympanic cavity. And sternocleidomastoid muscle, blood supply, same name muscles. Middle branches are continuation of the external carotid artery. First, it is superficial temporal artery. It directs medially from the parotid gland to the temporal fossa of the skull. Near the zygomatic artery, this artery gives transverse facial artery. On the zygomatic bone give zygoorbital, zygofacial, zygotemporal branches. Blood supply the zygomatic bone and muscles near them. This artery give the glandular branches to the parotid gland. Blood supply the parotid gland. And on the near the temporal fossa, at the level of the temporal fossa, it gives the frontal branches, parietal branches, and middle temporal artery. Blood supply the roof of the skull, frontal, parietal, occipital, temporal, squamous, and skin and muscle and skin of this region. The main important artery on the middle group is maxillary artery, arteria maxillaris. This maxillary artery originates at the level of the belly of the digastric, posterior belly of the digastric muscle. It directs behind the ramus of the mandible into the infratemporal fossa and into the pterygopalatine fossa. This artery topographically has retromandibular patch, pterygoid patch, and pterygopalatine patch. On the retromandibular patch, this artery give three branches: deep auricular artery, blood supply the temporomandibular joint. anterior tympanic artery, blood supply the anterior surface of the tympanic cavity, and inferior alveolar artery. Inferior alveolar artery includes into the mandibular canal and exit through the mental opening. Blood supply the mandible, give the dental branch to the inferior teeth, and blood supply the mucosa of the vestibulum of the oral rhyme. On the inside the pterygoid part, this maxillary artery gives muscular branches to the masticatory muscles. To the temporal muscle, it is deep temporal artery. Masseteric artery, blood supply the masseter muscle. Medial pterygoid artery, blood supply the medial pterygoid muscle. And lateral pterygoid artery, blood supply the lateral pterygoid muscle. On this part, this artery gives very important artery. It is arteria meningi media, middle meningeal artery. This artery enters through the spinous opening into the middle cranial fossa, lies under the dura mater of the brain. Blood supply the dura mater of the middle cranial fossa, ganglion of the trigeminal nerve, which lie on the trigeminal impression of temporal artery. And this artery gives superior tympanic artery to the tegmen tympani. Tegmen tympani is superior surface of tympanic cavity. Then this artery directs into the on this pterygoid part. This artery gives the posterior superior alveolar artery, which directs into the posterior superior alveolar canals on the maxillary tube of the maxilla, and blood supply superior premolars and molars. And this artery gives the buccal artery, buccinate artery, which blood supply the same name muscle. Inside the pterygopalatine fossa, the branches of the maxillary artery correspond to the connections of this fossa. Pterygopalatine fossa connect with the orbital cavity through the inferior orbital fissure, infraorbital artery, through the infraorbital fissure directs into the orbital cavity, lies on the groove for infraorbital groove and into the infraorbital canal, and exits on the infraorbital opening. This artery blood supply the inferior rectus and inferior oblique muscle of the eyeball. Blood supply the muscle and skin of the infraorbital region, and in the infraorbital canal it gives the branches anterior superior alveolar arteries, which blood supply the maxilla and give the dental branches to the superior incisors and canine teeth. The next artery, it is sphenopalatine artery, arteria through the sphenopalatine opening directs into the from the pterygopalatine fossa into the nasal cavity. Blood supply the lateral wall, posterior 2/3 of the lateral wall, and nasal septum. The next artery, pterygopalatine fossa, connects with the oral cavity through the greater palatine canal. Maxillary artery give the descending palatine artery, which blood supply the hard palate, soft palate, and give the incisive to the incisive canal and incisive artery, which blood supply the skin of the vestibulum of the nasal cavity. This is pterygopalatine patch of the branches on the pterygopalatine patch of the maxillary artery. And then third branch of the on the middle group, which is ascending pharyngeal artery. Originates from the medial surface of the external carotid artery, lifts parallel to the outer surface of the pharynx. Blood supply the pharynx, and give the posterior meningeal branch to the posterior cranial fossa, which enters into the through the jugular opening into the posterior cranial fossa. This is maxillary artery. Here what we can see the on the branches of this artery. This is superior thyroid artery, lingual artery, facial artery. Then maxillary artery, it is we can see the retromandibular patch inside the mandible, the inferior alveolar artery give the dental branches to the inferior teeth. We can see the temporal, superficial temporal, middle or deep temporal branches, infraorbital artery, buccal artery. On the head, on the temporal region of the head, we can see the superficial temporal artery. It's blood supply the frontal region, frontal branches, parietal branch, and middle temporal artery. Out occipital region and posterior auricular region, blood supply from the posterior branches of the internal or external carotid artery. Middle meningeal artery through the spinous opening of the sphenoid bone enters into the middle cranial fossa, lies between the bone or between the periosteum and dura match. Blood supply the dura match of the brain. It is very dangerous artery if the person have the trauma on the temporal squama. This artery can blood excretion and the person dead. The person will dead. Inside the nasal cavity, we can see the nasal septum. sphenopeloton artery blood supply the conchus of the nasal cavity, air sinuses of the nasal cavity. On the hard pellet we can see the through the greater palatine canal, inside the greater palatine canal, downs the descending palatine artery. Blood supply the hard pellet bones, mucosa of the hard pellet. You give the through the foramen incisivum. Give the incisive artery. Here with the soft pellet blood supply by two arteries, ascending palatine from the facial artery and descending palatine from the maxillary artery. Maxillary artery, but we can see the very important canal, infraorbital canal. Blood supply, characteristic of the blood supply of the upper teeth. Incisive and canines blood supplies from the infraorbital artery. Premolar and molar from the posterior, superior alveolar arteries. Это у нас. There are practical points on the head and neck. We can palpate the pulse on the common carotid artery inside the carotid trigon. We can palpate the pulse on the superficial temporal artery and pressure them during the blood excretion on the this point above the zygomatic arch in front of the auricle. This is pressure point, punction point. Facial artery. Facial artery during the blood excretion on the face, we can pressure on to the body of the mandible in front of the anteriorly from mesenteric muscle. And common carotid artery subdivides into the external and internal carotid arteries. External carotid artery have 3 anterior branches, 3 posterior branches, and 3 middle branches.